So we've experienced over 900 hours of blackout since the start of this year, and public healthcare facilities such as hospitals and clinics have not been immune. What is an inconvenience for many of us becomes a life and death situation in a hospital setting. Last night, you might remember, we spoke to Dr. Adam Mohammed, Head of Internal Medicine at Charlotte Maxeke Academic Hospital here in Johannesburg. He has echoed the call for hospitals to be excluded from any power cut schedule. Let's discuss this now with Dr. Ramphelane Morewane, Acting Deputy Director General for Primary Healthcare at the Department of Health. My apologies, it's Mr. Morewane. Thank you very much for joining us. So, hospitals, we know, have backup systems, but they, of course, are ailing as well under the on and again, off again system of load shedding. Does the health department support the call for our hospitals to be exempt from load shedding?
Good evening, Sally, and good evening to the viewers of the eNCA. True, I mean, it's actually a desirable position that there could be, a way of, if possible, exempting health facilities, because we're dealing with matters of life and death. So, but I mean, I guess that's a call that would have to be made at a very high level, and that decision would have to be made at a high level. Because you can imagine, I mean, what would happen if the power was to be off while somebody's on the operating theater, and what would happen to commodities that are being used when the power is off. And so it's indeed a challenge. But I guess, I mean, that call would have to be made at a very high level, higher than where I am. But it's a position that, I mean, I would support, because the colleague that spoke to you earlier, as we referred, frankly, I mean, they're speaking from the experience from the coal face. I mean, and we're sitting and obviously receiving reports from that level to say what's the kind of a frustration they are having. And when people come to that conclusion, you can't blame them for thinking that it would make good sense to have them exempted, from load shedding.
So you would support the call for the Department of Health to try and get an exemption from load shedding at the various hospitals. Has there been any actual movement within the Department of Health to take this matter forward with Eskom?
No. I mean, as I'm saying, I mean, it's a high level call that would have to be made. If it has to be made, I mean, obviously to involve much more senior people.
Yeah,
do that. But I'm saying,
so sorry to interrupt, but we did ask to speak to someone from the Department of Health who could actually answer these questions. So you were the person given to us. So if you say you can't, you support it, but you don't know if there's been any intervention or any discussion, that doesn't really help us, does it?
No. Let me put it correct. I mean, the correct perspective. I'm saying, you see, we talk about a public entity, right, that reports to another department, and I'm saying it's a call to be made at a very senior level, not at the administrative level. I mean, it's a very senior,
yeah. So
it's a serious call that would have to be made.
Would you say the health minister would have to make that call?
The leadership of the health sector will have to make that call.
All right. Do you know if they're considering it?
Look, I mean, there are many options that are being considered, because
but is
number
that
one
of them? Is that one of them, though? Do you know, or not?
Let me just explain what's happening.
Sure.
Because otherwise, if you box me, I'll not be able to. Let me tell you, as a standard, when a hospital is being built, I mean, we put up a generator, right, or a standby generator for backup energy supply, and there's obviously that is part of the standard for infrastructure development. And each of them will then have to have uninterrupted power supply. And it's a matter that has not started now. It started from way back, whenever we built new hospitals, even those that were built in erstwhile times. They've had to have generators that have got uninterrupted power supply so that there's no disruption. Now, of course, the problem that you would have is that when these repeated power outages, of course, I mean, it then puts a load on the generators. I mean, it will put load in terms of diesel.
This is exactly why the doctors are so desperate. I mean, you are explaining the problem quite well, but we're aware of the problem. I suppose I'm coming to get some sense of accountability, some sense of planning, and some sense of urgency.
Hence I'm saying, there's got to be an engagement with ESCOM, if this assisting is initiating the engagement, it's because when you get calls from the coal face, people are saying even with generators we're not able to cope.
Exactly.
It may then require an intervention at a very higher level. That's what I'm saying.
And are you saying you would not know if that engagement is being considered or conducted, or it's not actually on the cards yet?
At this moment, I'm not aware, but I mean, it's something that we can easily establish and come back to the media to explain.
That would be lovely. So. I would appreciate that. I want to ask one quick question about, there've been a lot of calls, distress calls, from the medical fraternity, particularly over what is happening at Gauteng hospitals. Specifically, though, I want to ask you about Charlotte Maxeke, devastated by fire last April. Still not back on its feet. Professor Mohammed saying that I think only 20 to 30% of the hospital is actually functional. Why is it taking so long?
I think both the minister and the premier have gone on the media to explain. I'm looking
for an update. What do you know today that is perhaps new?
No, Sally, I'll give you the answers. Don't worry. I'm saying that has been happening, and there's been an engagement at the highest level, at the level of the Director General and the level of the head of department on that matter. I don't have up-to-dates as of now, as we speak, but I know as recent as yesterday, the whole day, the DG and the head of department were engaged in Gauteng to deal with the matters of Charlotte Maxeke. And I'm sure, again, in due time, we'll be able to announce. And the reason we don't want to rush is it doesn't help to quickly announce on something until we certainly sure that what we bring into the public is something that will stand. Others will come, and next week you then asking will then be going back and forth. So I think let's allow that process of the very senior accounting officers, both at national and at a provincial level, to engage with it. And as soon as they've made the progress, we should be able to come back to South Africa and inform them. And I know that people on the ground are anxious, but I'm sure that there's mechanisms on the ground, particularly at the hospital level, to update the staff as to what is happening every day. But of course, they are expressing frustration because they are facing the patients every day. But I don't think there's just that silence and so where nobody can explain what is happening. But let's allow that process to go on. At the right time, the department will come back and give a proper update to the media so that everybody knows exactly what's happening with Charlotte Maxeke.
All right, thank you very much for chatting to us, Ramphelane Morewane, Acting Deputy Director General for Primary Healthcare at the Department of Health. Still to come.